Olive leaf extract, one of the Mediterranean's most powerful natural supplements, has been quietly supporting blood sugar and cardiovascular health for over 7,000 years, and the science behind its effects might surprise you. You've probably walked past olive trees countless times, admiring their silvery green leaves without realizing you were looking at one of nature's most concentrated sources of polyphenols. While most people know about olive oil's benefits, the leaves of the olive tree contain something even more potent: oleuropein and its bioactive metabolite hydroxytyrosol. Today, we're going to explore how this ancient remedy from blue zone regions like Sardinia and Icaria is proving itself in modern medical research, with results that are frankly astounding. Let me start with something that'll grab your attention. In clinical trials, olive leaf extract has lowered systolic blood pressure by over 11 points and reduced blood sugar levels by up to 26%. To put that in perspective, that's performance comparable to prescription medications, but we're talking about a leaf that's been safely consumed for thousands of years. The story of olive leaf extract begins in ancient Egypt, where they believed these leaves could mummify bodies and ward off illness. The Greeks and Romans took this knowledge and ran with it, with Hippocrates himself documenting over 60 medicinal uses for olive-related compounds. But here's what's fascinating. They were onto something that modern science is only now fully understanding through advanced polyphenol research. The secret lies in a compound called oleuropein and its metabolite hydroxytyrosol. This is what gives unripe olives their bitter taste, and it's concentrated in the leaves. While olive oil contains only 0.05 to 0.12% oleuropein, olive leaves pack between 1 and 14%. That's up to 2,800 times more concentrated. Notably, hydroxytyrosol has the only FDA-approved health claim for protecting LDL cholesterol from oxidative damage, a distinction that highlights its scientifically validated benefits. Now, let's talk about what this means for your blood sugar. If you're over 60, you're probably acutely aware that blood sugar management becomes increasingly important with age. The statistics are sobering. We now have over 800 million adults worldwide living with diabetes mellitus, and that number has quadrupled since 1990. But here's where olive leaf extract becomes genuinely exciting. In controlled studies, researchers have found that this compound works through multiple pathways to help regulate blood sugar. The mechanism is quite elegant. Oleuropein affects what are called insulin receptor substrates, particularly IRS1 and IRS2. When these activate, they stimulate a protein called ACT, which essentially opens the door for glucose to enter your cells via GLUT4 transporters where it belongs, rather than circulating in your bloodstream where it can cause damage. But there's another pathway that's equally important. Olive leaf extract acts as what's called an alpha-glucosidase inhibitor. This enzyme breaks down carbs into sugar. By slowing down this enzyme, olive leaf extract reduces those dangerous blood sugar spikes that happen after meals. In one study, diabetic subjects saw their fasting blood glucose drop to 174. More importantly, their HbA1c, the gold standard for measuring long-term control, showed significant improvements. But here's the kicker. When olive leaf extract was combined with metformin, blood glucose dropped to just 121 milligrams per deciliter. That's getting into the normal range. The research on bay leaves showed similar glucose reductions. Think about what that means for your daily life. Better energy, fewer complications, and potentially less reliance on medications. Now let's shift gears and talk about your arteries, because this is where olive leaf extract really shows its versatility through multiple polyphenolic compounds. Your cardiovascular system is essentially the highway system of your body, and keeping those highways clear and flexible becomes crucial as we age. High blood pressure affects nearly half of all American adults, and the risk increases significantly after age 60. Traditional medicine has been the standard approach. In 2011, researchers compared olive leaf extract head-to-head with captopril, a widely prescribed ACE inhibitor. The results were stunning. Both reduced systolic blood pressure significantly. But here's where it gets even better. The olive leaf extract group also saw a significant reduction in triglycerides, something the drug group didn't see. Recent meta-analyses involving over 800 participants have confirmed these findings. Olive leaf extract consistently reduces systolic blood pressure across multiple studies. Every 10-point reduction in pressure substantially reduces cardiovascular risk. Improvements could reduce the risk of stroke and heart attack by over 20%. Olive leaf extract proves that ancient wisdom and modern science can work together to support your health. It's a powerful tool for a longer, healthier life. But how does this actually work? The mechanism is quite sophisticated. Oleuropein, hydroxytyrosol, and another compound called oleasin act as natural ACE inhibitors. ACE stands for angiotensin-converting enzyme, and it's the same target that many blood pressure medications aim for. By inhibiting this enzyme, olive leaf extract helps relax your blood vessels, allowing blood to flow more freely. There's also a direct effect on your blood vessels themselves through endothelial function enhancement. Research shows that oleuropein has what scientists call a vasodilatory effect. It literally helps your blood vessels open up by increasing nitric oxide production. It also acts as a calcium channel blocker, which is another mechanism that prescription blood pressure medications use. Most importantly, olive leaf extract helps protect your arteries from the inside out. Studies show it prevents LDL cholesterol, that's the bad cholesterol, from building up in your artery walls through the hydroxytyrosol pathway. This is crucial because arterial plaque is what leads to heart attacks and strokes. The verbascoside content in olive leaf extract also contributes to this protective effect through additional antioxidant mechanisms. Recent research has examined olive leaf extract's effects on the endothelium. That's the inner lining of your blood vessels. When this lining becomes inflamed or damaged, it's an early step toward cardiovascular disease. Olive leaf extract reduces inflammatory markers like IL-6 and IL-8, and it protects against oxidative DNA damage in these crucial cells through oleocanthal and other anti-inflammatory compounds. There's even evidence that olive leaf extract affects platelet function. Platelets are the blood cells responsible for clotting, and while clotting is important for healing wounds, excessive platelet aggregation can lead to dangerous blood clots. Studies show that olive leaf polyphenols significantly suppress platelet aggregation in a dose-dependent manner. Now, let's talk about dosing and safety, because I know that's on your mind. The studies showing benefits typically use doses between 500 and 1,000 milligrams daily. Most research has used 500 milligrams twice daily, which seems to be the sweet spot for both blood sugar and cardiovascular benefits. The safety profile is remarkably good. Olive leaves have been part of the Mediterranean diet for thousands of years, so we have extensive real-world experience with their safety. The controlled studies report minimal side effects. Some people experienced mild symptoms like coughing, dizziness, stomach discomfort, or headaches, but these were generally rare and mild. However, there are some important considerations. If you're already taking blood pressure medications or diabetes medications, you absolutely need to work with your healthcare provider before adding olive leaf extract. Since it can lower both blood pressure and blood sugar, combining it with medications could potentially cause these levels to drop too low. People with kidney disease should also consult their physician, as should anyone who's allergic to olive pollen. And if you're pregnant or breastfeeding, there isn't enough safety data to recommend olive leaf extract. One thing to keep in mind is regulatory status. While the EU's European Food Safety Authority, EFSA, has approved health claims for olive polyphenols, the FDA considers olive leaf extract a dietary supplement. This means quality can vary between manufacturers. Look for products that specify the oleuropein and hydroxytyrosol content and have been tested by third-party laboratories. The research continues to evolve. A 2025 study published in Phytotherapy Research analyzed data from 248 participants and confirmed the blood pressure benefits. Another 2025 trial called ESOLED is specifically looking at olive leaf extract's effects in people with diabetes, which should provide even more clarity about its blood sugar benefits and HbA1c improvements. What's particularly exciting is research into olive leaf extract's effects on diabetic complications. New studies suggest it may help protect against diabetes-related damage to blood vessels, which is one of the most serious long-term consequences of the disease. The Mediterranean connection can't be ignored either. Populations in blue zone regions like Icaria and Sardinia that consume olive products as part of their traditional diet have lower rates of cardiovascular disease, diabetes, and many age-related health problems. While olive oil gets most of the credit, emerging research suggests that olive leaves, consumed as tea or extract, may be an equally important part of this protective effect through their concentrated polyphenol content. Looking at the bigger picture, we're dealing with a diabetes epidemic that shows no signs of slowing down. The number of adults with diabetes has increased from 7% to 14% globally between 1990 and 2022. Healthcare costs related to diabetes exceeded $1 trillion in 2024, a 338% increase over 17 years. Against this backdrop, natural approaches that can help manage blood sugar and protect cardiovascular health become incredibly valuable. Olive leaf extract isn't a magic bullet, and it shouldn't replace proven medical treatments. But as part of a comprehensive approach to healthy aging, the evidence is compelling. The beauty of olive leaf extract lies in its dual action through multiple bioactive compounds. It's not just addressing one problem, it's supporting both blood sugar regulation and cardiovascular health simultaneously through oleuropein, hydroxytyrosol, verbascoside, and oleuropein. Given how interconnected these systems are, especially as we age, this comprehensive approach makes a lot of sense. What we're seeing with olive leaf extract is a perfect example of how traditional wisdom and modern science can complement each other. Ancient cultures in the Mediterranean recognized something beneficial about these leaves, and now we have the tools to understand exactly why they work through polyphenol biochemistry and how to use them most effectively. The research continues to build, and the results consistently point in the same direction. Olive leaf extract offers genuine, measurable benefits for two of the most important health concerns facing people over 60. As always, the best approach is to discuss these findings with your healthcare provider and consider how olive leaf extract might fit into your overall health strategy. The simple olive leaf, overlooked for so long, may just be one of nature's best-kept secrets for healthy aging. And now you know why.